As mentioned, more than 40% of all cases among Native Americans in Wisconsin were reported just this month alone. That's according to the state, with numbers dating back to April. As far as total numbers in Wisconsin, about 38% of cases have come this month. NBC 26's Eric Kress spoke with a public health officer from the Oneida Nation.
Wisconsinites just endured the worst month on record as far as positive cases of COVID-19.
We've seen increases in all age groups, and we track data on a daily basis.
Oneida Nation Public Health Officer Michelle Myers says the last few weeks, more and more people from the Oneida Nation have contracted the virus, many having a notion where they likely got it.
When we talk with these folks, they know of an activity, a high-risk activity that they've participated in where they could have gotten it.
Currently, the Department of Health Services reports that 606 Native Americans in Wisconsin contracted COVID-19 in September alone.
The numbers continue to increase as they do in all jurisdictions.
But let's take a look at the trend. Back in April, when DHS started keeping track of Native American COVID-19 cases, the numbers rarely grew more than a dozen from one day to the next, and that trend lasted through August.
We definitely saw an increase during the month of September.
But by the time September hit, COVID cases in Native American populations were increasing by 20, 30, and 40 plus cases nearly every day. And today we know that over 40% of all COVID-19 cases documented so far amongst Native Americans in Wisconsin were contracted in September.
We can do this, but we all need to do this together. Everybody's actions impacts the community, and it has to happen in every community.
In the Oneida Nation, Eric Kress, NBC 26.
And as of today, the state reports that 1,381 Native Americans have contracted COVID-19 statewide. That's an increase of 606 over the last month.